Hello everyone, and welcome to Catholic Care's Talking Families webinar. Today we'll be addressing how and why the COVID lockdown periods of 2020 and again now in 2021 have disproportionately been affecting our vulnerable families. My name is Jonathan Melrose Ray, and I'm the General Manager of Community Engagement at Catholic Care Sydney, and I'll be your moderator today. I'm so pleased to see so many people joining us on this webinar, and I thank you all for being here and making the time out of your busy day to learn more about what we're doing and very much about how we're supporting those vulnerable families and groups in Southwest Sydney and across Sydney and indeed New South Wales. I'd like to begin by acknowledging the Aboriginal peoples of the nations on the lands that we are all meeting from today, all across Sydney. We acknowledge all elders, past, present and emerging, and thank them for their stewardship. I'm speaking to you today from the Gundagara and Tarawal lands. Now, please let me briefly introduce you to our speakers today. They both have practical experience, and their stories they will be sharing will show you the harshest impact of COVID on the most vulnerable in our community. First, we'll hear from Vanessa Harnish-Makar. I hope I said that correctly, Vanessa, the practice manager of Catholic Care's Parent Line. And then we'll hear from Haneen Al-Saifi. Haneen's role includes managing Catholic Care's family support programs in Southwest Sydney. But before we delve in, a little bit of housekeeping. Questions will be taken during the session, and at the end, please write them in the Q&A box found at the bottom of your screens. This webinar is being recorded, and we will share it after this session. So with that in mind, can I please introduce you to Vanessa to share some insights from Parent Line's New South Wales work. It's a service that currently supports over 8,000 families annually. So Vanessa, why don't you tell us a bit about your background and your role at Catholic Care.
Okay, hi everyone. I'm the manager of a really fantastic team of counsellors who support families all across New South Wales. My training is in psychology and family therapy, and I've been working with Parent Line for about 10 years now. Before this role, I worked as a parenting counsellor, as a school counsellor, a family therapist and a caseworker. Parent Line speaks to sort of parents and carers as a one-off call. Sometimes people just ring us once, but other times we've got parents and carers who call us regularly for ongoing support. So, we've got a team of really wonderfully skilled counsellors that are a phone call away.
Excellent, thank you. So, jumping right in, Vanessa, so can you tell us what is the reality of the situation for people accessing Parent Line New South Wales service today in this lockdown?
Look, COVID and the lockdowns has meant that the families that call us are in more complex circumstances than they were prior to COVID. We're getting lots of calls from parents of teenagers who are really worrying about school engagement through to mental health issues such as depression, anxiety, self-harm, suicidal ideation. Lots of parents are worried about the impact of technology and their children and young people being online for really long periods of time, particularly late at night. Families have become hothouses. We used to have the break of school and work and extracurricular activities, seeing family and friends, and no one's getting that contact at the moment. And so I think families have become really stressful places for lots of people.
They're really, so in the lockdown, they're focused internally and those issues are starting to bubble up, aren't they? So What are the top issues that people are presenting right now through the lockdown? And have you seen any changes between, let's say, 2019 pre-lockdown, the 2020 lockdown and this lockdown?
Look, one of the most concerning things we've noticed in the past, year or so has been the number of families who are calling us where we've identified a child or young person who's at risk of harm, where there are safety issues. And so I think it tells us that the lockdown and all the associated stresses related to that are turning families who might have previously been vulnerable, it's moving them into an at-risk category at a time when, for lots of families, it can feel like getting help and support is harder than it would have been before. So that's a big concern to us.
So for those of us who may not be familiar with that terminology, could you just briefly describe what a vulnerable family would look like versus an at-risk family?
Well, I think that vulnerable families are not, this is not an exhaustive list, but they're under stress. So it can be a sole parent or a difficult separated family situation where there's
Mm-hmm.
been domestic violence in the past, or
Mm-hmm.
children exposed to a parent's mental health or addiction, or anything that I guess threatens a child's well-being. So
Mm-hmm. Mm-hmm.
in prior to COVID, I think families were getting by, but the stresses of financial issues, not
Home
having
learning.
circuit breakers, home learning, all of those things have just tipped that little bit of families who were already on the edge. They've moved into feelings of not being able to cope, and we're getting calls from parents that have never asked for parenting help before. So
Mm.
even families who might have been going quite well pre-COVID um, are experiencing stress levels that they haven't had before.
And so are you seeing an increase in demand for your service?
Well, we have a limited number of counsellors answering the phone, so it's hard to know how many calls we could take potentially, but certainly in peak periods, we're not able to answer all the calls that come through. So that's a worry to us as well, because we really want families who are reaching out for support to be able to get that support. And
Mm.
while we can't change everything in a phone call, sometimes just the parent taking a break and making a phone call can help, make some difference and
Mm.
promote some reflective capacity and some different ways of viewing a situation that can, make a difference for some families.
And of course, you were saying the other day that you now have some, with your increased digital capacity through Facebook and Messenger and being able to capture the return calls,
Mm,
that should help some of that capturing those calls that are missed. So,
yeah.
has COVID meant that you've changed the services you delivered, or is it simply that you're, or not simply, I apologise for the use of that word, or is it that the counsellors are now seeing a broader range of issues?
I think that the intensity of the situations that families are calling us about has increased. So
Mm.
certainly there are also families that contact us via our online messenger or email, because having children around all the time, particularly for sole parents, they can't get the space to have a phone call. So
Mm.
that's I think been helpful. But I think like, for example, recently, I took a phone call from a mum, two teenagers, everyone's at home. Probably pre-COVID, everyone was going okay. Lockdown, this is the second time that the family have experienced lockdown. And, teenagers are disengaging from school. Both parents are trying to work from home. A lot of stress in the household, increased conflict, and the mum had never even thought about counselling or anything like that before. But in a discussion with her daughter that was quite heated, the daughter revealed that she'd attempted suicide in the last lockdown.
Gosh. Oh.
So the mum obviously calls us in a lot of distress,
Mm.
and really angry. And, so I think those situations that are really hothoused because of lockdown, young people have had a lot of losses.
Mm.
A
Mm.
lot of the nodal points of their school life have been lost.
Yeah. And I know the other day when we were talking and preparing for today's session, you were talking about the de-escalating the parent stress. Was that an example of doing that? So can you talk us through what do you mean by that?
Well, this mum in particular, when she called, she was really, really angry. She was really angry at her daughter, and really frustrated, and angry at her partner for not support. There was a lot of anger there. And I think, that she would have approached her daughter with that emotion as well. So sometimes what we can do over the phone, and being a neutral outside person, we can even notice those things, because, you know, generally underneath anger is a great deal of fear and concern and sadness and so on. And so even helping that mum reflect on that, you know, and tap into what was underneath that emotion, and that what was coming across to me, but also her daughter, as anger, was actually intense sadness and worry. And I think just someone noticing that can make a difference, a bit of a space to debrief and explore those feelings. And through that conversation, we're able to talk a bit about what difference it would make if she approached her daughter. You know, what from her daughter's point of view, her daughter was getting anger, so the daughter was going to respond by avoiding mum, and that made mum more upset and more worried, and, you know, that cycle continues. So
It's a bit of an escalation. So
absolutely.
your role is to de-escalate, and if I'm correcting right, help the parent to de-escalate the emotion and to support and focus on the child and the outcome you would
And
like there.
understand the
Yeah.
dynamics that have created that, because for this mum, she was able to see, yep, she was presenting as anger because she was also had her own work pressures and a whole range of other things going on as well. And for her to step out of that a little bit, consider what was going on for her teenager, and
Mm.
get a bit of an understanding of teenage brains and why developmentally this is particularly a difficult time. And you know, teenage mental health is a really big vulnerability at the moment, I think. So
I think you're right. Yes, absolutely. So you touched on the in that case, the daughter had revealed that she'd attempted suicide previously. So if a parent rang up and there was a potentially dangerous situation where the parent or the child was in harm, what's the process in that for care line? I'm sorry, parent line. Sorry, I was thinking about our other phone line.
look, we're, you know, our job is to be child focused, and so prioritizing the safety of children um, and young people, but also parents, because we know that the children's safety is directly related to parents' well-being. So we work really hard to have a trusting relationship with every caller, and to be non-judgmental. You know, that often people are in circumstances and behave in ways that are unintended, but respectfully look at the consequences, and work with the parent or carer to establish safety. So that can mean making a referral to another service and supporting the parent to connect with that service. It can also be in making sure that when the parent gets off the phone, that they're in a better position to parent their child, and to have conversations that move towards safety.
Very well. Thank you so much, Vanessa. I'll stop you there and look forward to picking up the conversation with you a little bit later. Um, I'll now jump over to Haneen, if I may. Um, Hello, Helene. Could you please tell us a bit about your background and your role at Catholic Care?
Hello. So, hi everybody. Um, I myself have arrived as a refugee to Australia. I from Iraq. I speak Arabic. I currently manage the family support programs in Southwest Sydney. We cover Liverpool and Fairfield LGA. My background of work, I've worked closely with refugees and asylum seekers, and also in out-of-home care for about 8 years, and I was a multicultural specialist.
Excellent. Thank you very much. Could you tell us about some of the families that you're currently working with?
The families that we support in Liverpool and Fairfield are the most vulnerable families. They have been referred to our programs due to having stress, needs, and also there's concerns for child safety. Those concerns could look like domestic violence, financial stress, neglect, challenging behaviors, risk of homelessness. So 35% of our clients are Aboriginal. 45% of our clients come from a culturally diverse background. We have I have a team of specialists that have different skill sets and also language skills to deliver services and support to those families that we currently have in our programs. Some of those languages could be Arabic, but different dialects, because Arabic have multiple dialects, Cantonese, Filipino, Vietnamese, and Maori.
Excellent. And so at the beginning of the session, we were talking about your personal experience in lockdown at the moment in Fairfield and Liverpool and your family background as refugees. So are you working specifically with any refugee families at the moment? Could you talk to us about how they're feeling the lockdown and how you're working with them in this process at this time?
So, as I mentioned, across my the programs that I manage and support, the percentage is 45% of those families come from a culturally diverse background, and what that looks like, they have been a second generation refugee, or they have arrived as refugees not long ago, or asylum seekers. So, as an example, we currently support a family who have arrived as an asylum seeker. I would like to call them refugees, to Australia. When we first started supporting this family, the mom was experiencing domestic violence and have 5 children. The other reasons for referral has been financial stress due to visa statuses, not able to work because she doesn't have working rights in Australia, risk of homelessness, and also challenging behaviours in 3 of her children out of the 5 due to the trauma they have experienced due to domestic violence.
My goodness.
Yeah, it's very difficult because this family before COVID-19 was just just making it above the line, and with COVID restrictions, they have they're now below the line, which you can imagine. These families in our programs already support the most vulnerable, and now because of COVID and the restrictions and the lockdown, they're more affected.
Yeah. So how, given the number of issues that are facing that client, you've got language barriers, you've got trauma experience, you've got domestic and family violence. I mean, how do you effectively make change with that family? And as you say, now they're in a much darker place because they have fallen below the line. So they're also deeply financially affected.
So we have worked with the family closely. Dad, or the perpetrator of domestic violence, is not at home currently. So we have supported mom to apply for an AVO to protect mom and the children. We have put safety plans when dad comes home. So mom to ensure that mom knows what to do if he comes back home, to protect herself and the children. We have supported mom in trying to pay for rent, and stay up to date with rent, to address the concern of homelessness. I'm lucky that I have a great team of professionals, and one of them is specialized in providing behavior supports due to environmental factors, but also due to disability. So we were able to provide mom with strategies to cope and to prevent the challenging behaviors at home. We also provided mom with a coping plan, and referred her to a local doctor to obtain a mental health plan to support her with coping with the current mental health, but also the post-traumatic disorder, because she comes from a refugee background.
And the children, are you working individually with the children as well?
So part of providing behavior support plan is we need to know why those issues are happening and address them. So we talk to mom about therapies, different therapies. Well, unfortunately, those that don't have visa statuses are not eligible for NDIS. So what we try to do is in-house support for those children, which look like art therapy, play therapy, and counselling as well.
Thank you. It's a very challenging environment to work in, and that poor family. I wanted to ask you, Haneen, it's been globally acknowledged that during the last lockdown, there was a loss of visibility of children at risk. Can you talk to us about that and what that actually means?
Part of safety planning for children and family support programs, or in particular intensive family preservation, the program that we're talking about here or focusing on, is having extra eyes on the child. And what that could look like is the child being seen by childcare educators, by school as well, by doctors to address the health needs, and also social workers, professionals, counsellors. So at the moment, or last lockdown and this lockdown has been struggling because the children are not attending school. And as we know, New South Wales has the highest rate of risk of significant harm. ROSH reports come from school and from health professionals.
Yeah, okay.
And at the moment, those children are not seen by those people. In addition to that, visibility could look like play groups, community support, family, friends, a safe village for that child, because it does take a village to take care of a child. So it has fallen back on the social workers in that work in those programs, such as intensive family preservation, to provide home visiting, to make sure that the child is safe, but also to address the concerns that the family have.
So, if I understand that, also in the detail there is that because of the limit of mobility allowed under the current lockdown situation, and they're not actually getting that informal eyes on the child either, and they're not getting the formal through the school or healthcare. Are we continuing to provide the face-to-face service? Are your team still visiting is there still someone with the eyes on the child?
Yes, so we're currently providing, it depends on the risk, of course, because we review this risk on an ongoing basis. Every program is different, and visitations are, the level of visitations is depending on the program and the risk. So we're currently providing 1 to 2 face-to-face visits to families that have children who are identified as at high risk. In addition, we're doing phone calls in between. It has been challenging, or it's in particular challenging for the families that we support in Liverpool and Fairfield, because as I mentioned, they are under 75% of our clients get referred to us because of financial stress. So it has been difficult to obtain the technology to support home learning and also telecare services.
Okay, so they're not technically equipped. So we still have the face-to-face visitation under the COVID safe guidelines, with the appropriate PPE, etc. Because they lack that technology, the finance or the affluence for the technology, or even probably in some instances the skills in that area. So you do run a number of programs under your family programs, support programs. Could you tell me how they scaffold to support the whole family in the community? So that's kind of, how do they integrate?
So as I mentioned, referrals come from different referring sources. It depends on the risk. the family will be identified under a different program. So what we do is we provide 6 to 9 months of case management and casework support to address the concerns, the referral concerns, but also if the family identify any needs for them. What that looks like, as I mentioned, is 1 to 2 visits a week and calls in between, in addition to referrals internally to Catholic Care and externally to other service providers to address the concerns, and also to work with the family to get them to a stage where parents can look after themselves and can look after their children without professional support and have their own community support or family support.
Excellent. Thank you. Thank you, Haneen. I'll bring Vanessa back into the discussion now. And before we start taking some questions from the participants, I suppose one of the questions that is at the front of my mind is across the range of your programs and opportunities for support through Parentline is how can families get further help in this lockdown if they're in need?
Look, certainly from Parentline's point of view, and I guess I take the point, Haneen, it's the most vulnerable families that don't necessarily have access to a mobile phone that's not shared or internet, that can limit, but most services can accommodate that. So certainly any family we would speak to, we would ask them about their needs, but also what would impact them accessing support, and work to help make sure we're setting them up to be able to utilise available supports. Lots of services are still operating, although via telehealth. And I think it's just, if anyone is watching and is concerned about a family or know someone who could use some support, there are phone lines like Parentline and Careline, that will work to get you what you need.
And I know we will send our participants some further information on Parentline and our programs, but just for today, the phone number for Parentline, Vanessa?
1300 1300 52.
1300 1300 52. Thank you so much.
Can I just add to what Vanessa has said, and I do agree, it's the most vulnerable. Last year there was some support for families that we worked with during the last lockdown last year in 2020. The Department of Community and Justice have provided laptops to those families, so they continue supporting their children to provide home learning, but also to do this telecare services. This year, we've not been lucky, and nobody has provided our clients that support. So parents still go to school to obtain homework or learning materials, which has been very difficult, and it adds to the stress of families. They don't have the technology. They don't,
that's right.
The technology, or even the money to support internet.
So those families, Haneen, I get that right. They don't have the access to the digital at-home learning, so they're going to the school to get the paper-based learning to bring home. So they're putting themselves out in risk as well, which is very challenging.
And we are talking about single parents, because 50% of our families are single parents. So they have to take their children to school, put them at risk to get those materials. Gosh.
Well, I think I'll open it up for some questions from the participants today. I have a couple here. One of the questions that has come in is around the source of funding for your programs. So maybe we can start with Vanessa and then move to Haneen.
So Parentline is funded by the Department of Communities and Justice. That's where most of our funding, and we get a small annual grant from to support our disability specialist counsellor.
Okay, thank you. And Haneen, I hear that yours sounds slightly more complicated and more philanthropic based.
It depends on what program, because I support 3 programs. So intensive family preservation is funded by Department of Communities and Justice. It is a very high risk program. It has some financial support to families, very limited. Family support program is funded by DCJ with no financial assistance to clients. And within that program, I have a disability and challenging behavior specialist who we determined there's a high need for those that fall between the gap. So it's not funded by anybody, but we've put it under family support as a one caseworker, a full-time caseworker. We also have the parish program that supports anybody that needs help in the community, and it is funded by Catholic Care and the Sydney Archdiocese, and some of that money comes from local parishes because they have identified there is a need in their community for support.
Thank you. Thank you. I have another question as well. I think this must be from somebody who also works in the same sector, and they've asked the question that at this time I have been asked as part of my role to do wellbeing call-ins to families. Could you suggest a framework around this, please? Might be a longer answer, but
it is. I mean, it all depends on the risk, because I can guess from the question that it's an ongoing service. It's not a one-off. So what it could look like is calling families, checking up on them, providing them with coping strategies, because many families, especially those that have children with disabilities and challenging behaviors, it's hard for them to cope because previously they've had respite services or other support services, and currently there's none of that available because of the lockdown. So it's been difficult. So I would suggest that you work on well-being, mental health, providing coping strategies, and also keeping advice parents to keep children stimulated. So basically being creative and, gardening and drawing, because kids need a space to express how they're feeling. They're not going to school, which for some of those children, it's their getaway from home and the current environment.
And I would just add to that too. I mean, I think if you can have a safe, judgmental space for the parent to say, well, is there anything you're worried about? What have you noticed? Asking about children's behaviour, because we know that can reflect the household, and parents coping. So I hope that kind of answers.
Yeah, I think so. I think that it's a big question, and it is dependent on the case and the program and the outcomes. But we've also had another question, which I think has been sitting with a few of us around the impact of trauma in terms of children's behaviour in this space. So as you were talking about earlier, I think I should imagine that a child who's experienced trauma in their life and in a normal circumstances outside of a pandemic, their support would be ongoing, it would be visible, there would be continuous pathway through. Whereas now we've got this situation where that may not be happening and the trauma may be forcing some behaviour that has not previously seen. Can we talk about that for a minute? Have you experienced that, Haneen, in any of your programs?
Yes. There's definitely have been an escalation in behavior in children, because especially children that have experienced trauma and have currently post-traumatic disorder, anxiety, depression. It's very challenging for them because the uncertainty. Those children, not only parents, but those children are used to respite services, are used to group, are used to activities, therapy, which is currently not being provided, which makes it very hard for the children that we're working with. And it needs a lot of besides technology, we need a lot of, supported activities for those children, even at home. So it might look like, a boxing glove and, a boxing bag, or it looks like a garden, or it looks like sand therapy. There's a lot of ways to deal with that, but it's been very challenging for those children, but it's also very challenging for those parents, because, as I said, they receive that support and respite when children are attending activities, and at the moment that's not happening.
Yeah. Absolutely. And I would just add to Hanin, we get calls from parents who are very frustrated because some of those services, like OT and speech, being moved to online, they're not always practical. It puts that burden on parents. And and so we often will talk about the loss of those opportunities to get some space mean they're not equipped to do it right now.
Definitely agree, because when we look at OT, occupational therapy, and also behaviour intervention therapy, it all depends on the environment and the response of parents. And, it being in a video, so I'm currently sitting, you can't see what's happening around me, you can only see that box, which is very hard for professionals to provide a service and strategies if they can't see the environment, and if the child, for example, is running around.
Thank you. We have a couple of more questions, which I'll come back on to, but I'm conscious of the time, so I'd like to thank you both, Vanessa from Parentline and Hanin from Family Support Programs at Catholic Care, for joining us today. And I'd like to also extend my thanks to all of the participants who joined us here today. Thank you for giving up your valuable time to learn more about these programs. I think it's incredibly vital for all of us to understand the circumstances that these families are experiencing at the moment. For me, in my role at Catholic Care, it's about how I can then work with my team to better support Hanin and Vanessa to work with their clients. So I thank you all for today. That's our allotted time, but I have a couple of other questions which I'm going to go through. So you're more than welcome to stay on the line as we go through these questions. The first one, Hanin, is for you. It sounds more like a suggestion actually than a question, and the question goes, Hanin, how supportive has your local MP been in getting support for the families re computers, because those children, let alone the parents, are at a real disadvantage?
There has been no financial assistance. We've been listed, the parish program that I mentioned have been listed in the Fairfield people needing help registry, but they're all for elderly people, not for families and young children. As I mentioned last year, Department of Communities and Justice have provided laptops and internet for those families. This year, there hasn't been any support around technology. Prior to lockdown, if we have a struggling family that don't have income, who's at risk of homelessness or has needs, we usually approach local businesses and see if they like to support the families. At the moment, when we ask for that support, we are mindful that a lot of local businesses have been affected by COVID-19 as well. And that's why we're kind of in a tricky situation, because I would like to acknowledge it's hard for everybody, but imagine how hard it is for those vulnerable families that were just above the line, and COVID and restrictions and lockdowns have pushed them under the line.
Which it brings me to the next question, which is the question is, personally, where can I direct struggling families in my area, and will they have to wait long for help? Vanessa, that might be one for you.
Yeah, look, depending on what the needs of those families are and what area it is, we would certainly be able to direct you as to some options. But you're always welcome to direct families to contact Parentline directly, and we will offer whatever support we can find. Sometimes that means we will say to a caller, let us do some research, and we'll make calls on the person's behalf, and then get back to them with some ideas for support and some connections.
Can I just add to that? It's very important to understand if it's a long-term need or a short-term need. And it's because when we talk about needs, there's a lot of stress in the family that could lead to a need, and it could lead to a risk. So it's important to understand why you're referring the family and what sort of service do you need. Is it a long-term, is it a short-term service? And that way you can determine what pathway of referrals you're making.
Thank you. Well, we really are now at the end of our time. And I'd like to again thank our participants and Vanessa and Haneen for joining us today. It's really evident that COVID has created a host of challenges for our families, which has just reinforced our mission to provide the most appropriate support to help our families not just survive, but to thrive. And I'll say to all of us today that, this is why your support is so vital to the work that we need more than ever. And there are 3 ways that you can help: with a gift or a donation, or by referring us to others in your network who may be able to help us support with a gift, or by sharing our work with your community. Thank you for listening today, and we hope you gained some valuable insights from our speakers and experts in the field.